Thank you. Thank you, Aida. Hello, everyone. Welcome to our third webinar of our webinar series entitled Thriving in Safety, Advancing Adolescent Health and Rights and Ending Gender-Based Violence in Central and West Africa. Je m'appelle Montasser Kamal, je suis le directeur de la division Santé mondiale du Centre de recherche pour le développement international. Aujourd'hui, je serai coprésident du webinaire aux côtés de ma collègue Marie-Glorieuse Ngabire, directrice du Bureau pour l'Afrique centrale et de l'Ouest, qui se rejoindra à nous sous peu. Je tiens à souligner que le siège social du CRDI où nous sommes réunis aujourd'hui est situé sur le territoire non cédé de la nation Algonquin-Anishinaabe dans l'intendance des terres et des eaux que nous appelons aujourd'hui Ottawa remonte à des temps immémoriaux. 2024, à l'occasion du 3e anniversaire du programme d'action de la conférence internationale sur la population et le développement, le CRDI a lancé une série de webinaires sur l'intersection entre les violences basées sur le genre et la santé et les droits sexuels et reproductifs en Afrique centrale et de l'Ouest. A new study released last week at the International Conference on Family Planning highlights that every 9 seconds, an unsafe abortion endangers a woman's life in the region. Victim survivors of sexual violence in West and Central Africa still face severe barriers to accessing abortion care, even when legally permitted, due to re-traumatizing legal requirements, unclear medical guidance, procedural delays, and widespread stigma. Look at the chat. We're sharing the study link with you right now. Le premier webinaire intitulé Un aperçu régional donné
webinar called a general so the first webinar has explored the situation in terms of health and sexual rights for Africa, for Central and Africa. It united different actors in order to identify the gaps in terms of knowledge and to examine how can we support the health and the rights of adolescents. Between the main conclusions, the urgence of a demographic was noted. The adolescents represent 25% of the population, and they are confronted at a high level of infant marriages and genital mutilation. Despite the fact that some laws exist, their implementation is completely unequal, and we need to elaborate some policies in order to make sure that the services for the rights are there. Some difficulties like lack of disaggregated data and socioeconomical factors have been noted. The people have also noted that the sexual education is lacking and some political will and is needed in order to include or to ensure the rights for these adolescents. Now, I'd like to give the word for my colleague Maya Gulusa Inkabiri, Director of the African and Central African Bureau, in order to give us the summary of the second webinar and the session for today. Thank you, Muntasser, and welcome to everyone on this webinar. So, as it was highlighted, we just shared what happened in the first webinar, and just a reminder, the second webinar before this one was called Transforming the health and the rights of the population, best practices, and lesson learned. And this webinar has explored how the researchers and the actions can lead to a structural change. It presented projects led by the International Center for Advanced Research and Training, ICART, the Pansy Foundation, and initiatives supported by IDRC in countries like Gambia, Senegal, Burkina Faso, DRC, and Burundi. So these projects have used different methods in order to integrate the health education, talk about mental health, and also design adolescent and focus sexual and reproductive health services. So the speakers during this second webinar have emphasized inclusive and multidisciplinary approaches and highlighted the challenges such as social taboos, political resistance, and data gaps. The second webinar concluded with a call in order to bridge the gap between research and policy and to invest in youth centered strategies and foster intersectoral collaboration. So the links towards for these recordings have been put in the chat. So for those who did not have the chance to participate or want to remember the discussions that we had, do not hesitate to use these links. So today is the third and final webinar entitled Towards a Sustainable Future for Adolescent Health and Wellbeing in Central and West Africa. This webinar will foster a solution-oriented dialogue among researchers, policymakers, funders, and implementers. It will also focus on concrete recommendations for future programs and investments. So, we have two specific objectives for this webinar today. First is to create a space for cross-sectoral dialogue, encouraging diverse perspective from actors in research, funding, policy, and health systems. The second one is to highlight solutions and strategies and formulate concrete recommendations to improve health systems and the sexual and reproductive rights of adolescents and girls, and to foster sustained engagement from stakeholders, particularly in the fight against gender based violence. So, in order to reach these targets, we would like to start with a plenary presentation followed by a roundtable. And we will be starting with our speaker, Professor Isia Kassombier. It is my pleasure to introduce Mr. or Dr. Issa. He's a well-known epidemiologist. He has a lot of experience in the health sector in Western Africa. He is professor at the University of Burkina Faso, and he used to be the director of the Public and Health Department and Research at the Western African Organization for Health, OAS. He's the author of more than 150 scientific publications and is contributing to many regional and international researchers. And it is my pleasure to welcome Professor Sambier. Professor Sambier, the floor is yours. You have 10 minutes for your presentation. Thank you so much, Marie Glorieuse, and thank you for all the CRDI team for inviting me to this webinar. I was asked to talk about sexual and reproductive health and sex-based violence. So I would like to talk about this point in order by starting to giving you some information on the actual data that we have and while insisting on the role of researchers and by ending with some mechanisms in order to improve the programs. When it comes to the first point, I would like to insist on three points. So uh, the problems are trying to convince us that when we talk about adolescent, we try to change the demography in terms of the percentage of the representation of these adolescents. What is the profile of these what do they know? And all these elements are very important because there is a certain dynamic. It's not a static group. The second one is to talk about the evolution and the different sicknesses. When we talk about adolescent, they are exposed to a lot of health problems, illnesses, and uh, contagious illnesses. But when we talk about this group, they are exposed to many sicknesses and malnutrition accidents. And today we can see that there is an increase of the population of adolescents and young that is becoming obese or gain weight, which has impacted the future of health. So talking about adolescents is uh, leading us to think about these social constraints. And today they are interconnected and they have access to a lot of information, a lot of networks that are exposing them, unfortunately, to a lot of risks. So since 1994 till today, we have good message when it comes to uh, sexual health for adolescents. And we can see some evidence reduction of these illnesses and at the same time an improvement of the proportion of the adolescents using preservatives and or condoms. Today we have a reduction of the number of adolescents married before 18 years old and an improvement of using uh, contraceptive amongst adolescents who have a partner. And when it comes to contraception in some zones, we saw a doubling in the proportion of usage. We have a great message when it comes to uh, prevalence of genital mutilation, even though there are a lot of efforts that remain to be done. Unfortunately, the prevalence of the SST is in prevalence, especially with herpes that will expose them to other transmissible uh, illnesses. So when we look at the violence, the sexual-based violence, we need to note that a study has shown that between 15 to 24 years old, 18% have been subject to a sexual violence, whether a psychological, physical, sexual, or other types of violence. Unfortunately, in the group of the adolescent between 10 and 14 years old, we don't have a lot of data. And we know that this group is going through a lot of violences. Unfortunately, the studies need to um, allow us to document all these incidents. Adolescents and young people with the interconnection today, they're always online. They can also be subject to harassment. A study showed that 50% of young girls have been subjected to harassment, sexual harassments online, and they could be uh, feeling in danger physically. They have low self esteem and low self confidence, and they can also be very stressed mentally, emotionally, and can impact them when it comes to their school and studies. So we see that today there are problems related to sexual based violence, but we need to have more data when it comes to this group of children between 10 and 14 years old. So this will put them through a lot of questions regarding health, uh, mental health, and one on out of seven adolescents is going through mental problems. It could be anxiety, depression, or behavioral problems. And the large consequences of these problems is if they are not well taken care of, it will impact their physical and mental health and their future. Um, a lot of factors expose these adolescents, as you can see on the screen. Uh, Next slide, please. Unfortunately, when it comes to uh, adolescent between 15 and 12 years old have been subject to a lot of violence. In Africa, the adolescent between 15 and 20 years old, the ratio could be 75%. And it's one of these is an adolescent mother, and abortion, as Muntasir has just said, are a large problem. Next slide, please. So, what could be the role of researchers? Researchers' role is very important in order to help and to better understand and better design interventions. They need to identify the priorities and the needs in order and to collaborate with the stakeholders, because this is a very important and a key point, and to mobilize the skills that they have in order to document, to analyze the strategical plans, the programs that are established, and or educate people in order to allow the development. Once they have defined the priorities and the needs, they need to contribute to answer some questions in order to and to better formulate questions and put them in the best conceptual studies and give some contextual factors for the strategies. But what is very important, and what my colleague has mentioned, is that these research data need to be transferred to the politicians in order to secure them and to influence some political decisions. Next slide, please. Now, why is it important to have a multidisciplinary approach when we talk about sexual health for adolescents? How do we show it here? A lot of stakeholders need to intervene in order to help these adolescents and these young people. They are very important, their families and the healthcare. Uh, Professionals, the education, the schools, the government agency, the healthcare system, but also the decision makers, the professionals, and everyone need to work, and we need to work with all these actors in order to have a multidisciplinary approach in order to allow to this multidisciplinary action to be better understood and to be able to help in order to create more efficient intervention and a much more designed to the system in order to make sure that these interventions developed by the stakeholders and politicians. It is very important to have a certain mechanism. When we talk about health sexual health for adolescents, we need to create a certain coordination in order to make sure that the different actors coming from different levels can communicate. Because without this coordination, without this communication, it is very difficult to have communication and intervention that are adapted. Every stakeholders has a role to play, and it is the it's all of their actions together that will create a difference. We cannot act without using data. No program can respond to a reality if the program does not have the relevant data. That is why the professionals, researchers, and decision makers need to be trained to use the data and adapt the data in order to consolidate efficient programs. It is very important to act also on the financial matters. We need to see how to mobilize funds, and we need to think on how to conceptualize programs that are adapted, accepted, and applied, and we need to think of all the framework that are important for the implementation of these decisions. I followed the evaluation documentation is very important because it will allow us to see if the programs are accepted, adapted, if they are going in the right direction, and to foster communication and collaboration that are key elements. At the end, to conclude, I want to say if we have seen progress in the sexual health of adolescents, it will allow us to have the um, indicators that which the approach is important, and researchers play a key role in order to elaborate a program that is efficient and acceptable. And I would like to thank you for your participation. Thank you. Thank you so much, Professor Sambieu. Thank you for uh, this briefing and for sharing information and talking about the current situation, the role of researchers, and the importance of the data that we have, but also what are the options possible in order to maximize and optimize of the impact of the different programs and different intervention. Thank you one more time. So now it is time to start our roundtable, the second part of this webinar. So I am honored to present my colleague Avitatu Diop, who will be the moderator. Nafisatu is a specialist in the program in TRDA based in Ottawa. Nafisatu, the floor is yours. Thank you so much, Marie Glorieuse. And I would like to ask the panelists to uh, put their camera on, and I have the honor to present and to moderate this panel and to present the panelists. I will start with Madame Tracy Ebersek, representative of the Funds for the United Nations for the UNFPA population in Senegal. She has 30 years of experience in international development, and she has held key positions in Africa, Europe, and Central America, notably in the Peace Corps, UNOPS, and USAID. Welcome, Madam. For the participants and for those who need translation, please note that Madame Ebersek will give her a speech in English. The second moderator, Mr. Bertin Ritiganikwale, who is the program director at the Ponzi Foundation in the DRC for 9 years. He oversees the design, the implementation, and monitoring of projects related to the prevention and response to the gender-based violence, including sexual violence in conflict situations. Prior to Pansy, he held various positions with NGOs, including Norwegian Refugees Council, Court Aid, uh, Bread for Disadvantage, with a strong commitment to women's empowerment and conflict transformation for women. Welcome. Madame Astou Diouf Gay, She has been the National Director of Equity and Gender Equality at the Ministry of Family and Solidarity of Senegal since 2019. She has held several key government positions, including Director of Family Affairs and Technical Advisor. For over 20 years, she has represented Senegal in international forums on issues of gender, women's rights, and peace and security. Welcome, Madame Jusse. Last but not least, Dr. Abdul Mumuni Nuhu. He's a demographer with over 15 years of experience in the design, implementation, and evaluation of population and health programs in West Africa. He is researcher and executive director of GRAD Africa. His work focuses on maternal and child health, sexual and reproductive health, education, women empowerment, and broader demographic dynamic. Welcome, Mr. So let's start by the first questions. I will start with Mr. Bertin. Could you please let me know what are the main challenges by the adolescent facing sexual violences in your region? What collaborative approaches have you used to understand these challenges, and what innovative collaborative solution have you adopted to uh, that prove efficient? Thank you, Madam, for your question, and thank you for associating us to this webinar today. I would like to start by answering your question that when it comes to the Panzi Foundation where I work, we are establishing some holistic problem for the survivors of the survival of the survivors of sexual violence, and amongst the victims. We lost the sound with the speaker. So there are survivors that have less than 17 years old, and during the last 5 years we saw an increase of this percentage with 33.8% now of survivors who are less than 17 years old. These adolescents are confronted to many challenges, but I would like to highlight some, especially when they are pregnant because of sexual abuse. There is a problem of accepting this um, pregnancy caused by rape. So they are stigmatized, insulted during the consultation with the doctors. First of all, she will only know that she's pregnant a bit too late, and there's also the problem of the affection, and also they lose all hope for life. They need to leave school, and there are also the financial burden because her family does not consider her as the other members of the family, and she becomes a burden for her family. There are a lot of problems, and also um, among the community, especially that uh, if the criminal is member of an armed group, it becomes more complicated when the criminal is a member of the family of the victim. When it comes to the different approach that are used, we use the active codes, but we do the co-creation when we take responsibility. We do not impose anything on her. We associate her to all the processes of handling her problem. We established the approach Maman Chérie for the psychosocial assistant, and they are like artificial mothers for these survivors of rape. The solutions, we established a maison de casse. It's a foundation. It's a transit center to help people who are stigmatized or rejected by their family in order and to foster them for a year while we look for a solution and we can orient them. They do some activities, some therapeutical dances, music, and all the trainings in order to help them, to help these survivors, but also in order to allow the other survivors.
En termes de solutions innovantes aussi, on a mis en place il y a quelques années un modèle holistique d'accouchement.
Years ago, a holistic system to giving birth for these survivors and minors girls who happen to have some pregnancy. This does enable us to accompany them before 1 year and after giving birth as well. And this had provided us some concrete and positive replies and feedbacks that we are also following and coaching the parents of those young girls within the whole processes. And we are also sensitizing them and making them involved in all type of processes as well, or how to take care of these teenagers indeed. So that is in a very brief manner the summary of what I wanted to share with you, what is being done with those young teenagers who are victim of gender violence, indeed, sexual gender violence. Thank you. Thank you very much for this very rich presentation. Now, let me talk with Mrs. Ebesek, and I think that it is going to be in French and the slides would be in English. So those who would need simultaneous interpretation, please select on the Kyoto. Mrs. Ebesek, as UNFPA, could you tell us how you would integrate the specific needs of teenagers, please, as well as those of the much more isolated teenagers within the framework of your own strategies of sexual health and reproductive health as well? And also another type of question, and therefore you will provide a reply to both of them. What are the current priority in order to enhance and this health system which are concentrated on the African areas? The government, actors, NGOs, stakeholders. So in order to support your own efforts, you have the floor, madam.
It is a pleasure to be here with you all. UNFPA places adolescents' sexual and reproductive health at the heart of its priorities because we recognize that investing in youth is essential for harnessing the demographic dividend. So UNFPA strategies are designed to be inclusive, responsive, and youth-centered. UNFPA's approach aims to remove any social, cultural, legal barriers that prevent adolescents and young people from accessing sexual reproductive services. And for us, this is achieved through several avenues, and I'll just list a few for the sake of time. We partner with governments to develop and support the establishment of structures that are adapted for adolescents and young people, such as adolescent safe spaces, adolescents counseling centers, and young girls club. In these same structures, we also provide equipment, supplies, training, and operational support in order to ensure their continuation. We also collaborate with the national government through the regional authorities to provide decentralized mobile services with integrated sexual reproductive health in order to reach adolescents and young people, as we say, at the last mile. For us, when we design programs and we're looking at our strategy, we target youth from a range of investments. So from the time we're considering contraception to prevention and management of sexually transmitted infections, when we're looking at nutrition, psychosocial counseling, as well as the prevention of gender-based violence and fighting against female genital mutilation. UNFPA also contributes to ensure that accurate information and up-to-date information reaches adolescents through educational programs in schools and through extracurricular activities. The main objective here is to ensure that we are promoting healthy behavior. Young people are able to make informed choices, and this is a way we view that we could prevent child marriages and other harmful practices from continuing. Finally, we ensure that meaningful participation of adolescents starts from the very beginning, from the design, implementation, and monitoring of programs. So we're looking at and we engage with youth networks and other structures that implicate young people. In terms of the question related to priorities, our current priorities are aligned with achieving our three transformative results for UNFPA. Our priority is to reinforce an adolescent-centric health approach, as evidenced by strengthening the capacity of health systems and training health workers and staff so that they can provide services that meet the specific needs of adolescents and young people. We are also prioritizing an improved quality of care and services to adolescents by integrating sexual reproductive health into any care packages that are offered to Senegalese citizens. We also prioritize a multi-sectoral approach, meaning that we look at youth, not just youth, but health, education, and justice when we're looking at sexual reproductive health services. And we use existing community-based mechanisms such as community health workers, respected elders in the community, and other youth services. The other thing we are prioritizing is digital innovation, how we can use health apps and social media for communication, community engagement, and providing accessible information. Mainly, our priority also is to create an enabling environment. So what we're looking at is supporting governments in developing and implementing policies and legal frameworks that protect the rights of adolescents and young people, and how they may eliminate barriers based on age or marital status from accessing sexual reproductive health. Really quickly, it looks like I have a few seconds left. In terms of offering support, in Senegal, and I think across the continent, we have to acknowledge that youth issues are paramount. So for us, I think what needs to happen, my recommendation is there needs to be a shift in the vision and strategy. This is a long-term strategy. So if we're investing in adolescents' health, we need to understand we're investing now for what will happen in years to come. Thank you very much.
Merci beaucoup, Mme Ebersek. Alors, parlons maintenant de données.
What about the data with Dr. Nohom? Dr. Nohom, according to your own experience, what type of data and local evidence are still missing in order to orient some adapted policies to youth in the field of sexual reproductive as well to fight against gender-based violence, and starting from a very concrete example, how these data could be mobilized in order to enhance the collaboration among researchers, practitioners, decision makers, in order to transform these research outcomes into concrete actions. You have the floor, Doctor. Good evening, and thank you very much for this very good question. Let me precise that I'm a researcher and the executive director of Africa, which is a group of research and actions. And our mission would be to promote local leadership and to speed up the use of the local resources, the use of the different type of evidence, whether for the conception as well as for the implementation, indeed, in order to come up with some adapted solutions in Africa. And we've been working with different partners, indeed, whether from the universities here in Africa at the level of Western Africa, as well as on the international level as well. American universities, whether at Berkeley, San Diego, as well as in many other places in the States. And of course, with other actors who are attracted by this issue related to reproductive health, notably youth as well as adolescent. So this is why we have decided that all this needs to be carried out on the international level. We have also worked within the framework of how to prevent children marriages in order to reply to the question that have been asked, I would like to highlight that whenever we are talking about youth, adolescent, teenagers, so which ones are we talking about? Because generally speaking, in our own respective country, we happen to have this social stratification where there is an urban milieu or rural milieu with different realities. And so whenever we focus from different perspectives, when we are talking about young married children situations as well of those who are not married, mainly in the within the framework of the regulatory framework, I would like to highlight primarily according to our own experience or from our own experience indeed which dates about 10 years ago. So this difficulty to have qualitative data that would be able to translate the reality indeed and the reality and the social situation that we are confronted with, mainly the type of research on the local perception. We never talk about access to have access to this reproductive health. The perception of the different suppliers seems to be is very interesting, as well as the clarification of the value with regard to those who can or cannot, despite the regulatory framework which does exist, even if the parents are accountable and responsible indeed, and the community is playing a very important role indeed. So there is a lack of data at this level with regard to the role of those different actors, mainly their perception from the sociological perspective with regard to how the youth could have access to the reproductive and sexual health. There are several initiatives which had been carried out in this field. So this project which had been working mainly and focusing on the type of social norms as well as social media and focusing mainly on how youth could have access to reproductive health earlier on. As it was stated by the previous speaker, there are some data related to central mental health as well as the relationship between both of them. There have been some studies being carried out, but then again, they are not well distributed geographically speaking whenever we focus on the literature or we go through the literature in Mali, Burkina Faso, and many other issues. So the problem seems to be rather new, and we do need to learn even further on that in order to know exactly where are the boundaries, what are the frontiers indeed when we are talking about the teenagers type of crisis or where we are also to provide this type of right to the teenagers so that again we need to make more efforts in order to better understand the importance of the mental health of the youth because given our in our own context we seem to neglect whatever is related to mental health whenever as long as there is no physical type of manifestations. So there are several actors who are working on that, but I think that in the future we would need also to focus more on these specificities. The other point that seems to be very important, and is very important again to talk about it, because as I was stating, I think that Marie-Claude or Montessor was talking about the legal framework. We need some data related to the legal services being provided. Why? Because it is the legal framework that would enable us to have a context, indeed, which is very useful. So it is very important to have a very clear legal framework and very precise one. We have accomplished a type of work with the University of North Carolina on this issue related to access of the youth to the local full access, full choice. That is the title of this service. So full access as well as choice of this teenagers. But it was very interesting indeed. Why? Because we could analyze the legal framework of Niger, and this is how we could quantify what are the main issues that we can be confronted with. Very often we could highlight that whenever there is a confidentiality or violations of the life, private life of the youth by the different suppliers, what are the different type of positions they need to be taken and what are so the youth, for example, sometimes they are refused certain services. So we need to know exactly what needs to be done. There are some legal framework that needs to be implemented within the framework of how to promote sexual health, but those texts do not highlight what are the different type of steps to be taken when we are confronted to this type of scenario. Likewise, with the different consentment of the parents or the partners that you need to get permission from, so that the youth would have access to these services indeed, because sometimes they are haven't reached the age to have access to these type of services. That again, we do believe that what is needed, we need to make a type of where exactly are we positioned in different countries and what needs to be done in order to make it much more operational, and the different regulatory measures that needs to be undertaken, whether there are certain cases and how, or violations or rights violation, how all this had been managed. So we need to look at this sociological perspective in order to know how all this is being materialized so far. And then again, these are simple questions, but we need to focus on the different studies as well as to the youth whenever they need to have access to this type of service indeed. So in a very global manner, indeed, in order to conclude, if I may, how we could bring together the stakeholders, actors, as well as decision makers. So I think that it is within the framework of the shared conception. It's very often very difficult to bring on board the different type public authorities once the results are already achieved. And then again, what we have been noticing more and more from my own perspective as a researcher, as well as someone who is trying to implement this program, because we are also intervening within the different research. So we need to privilege from the very first time dialogue with the public authority, and the research happen to need information. There is a crucial need to acquire all this information from the public authority, and this would involve the partnership of the public sector, and does require this type of direct collaboration with the public sector, so that all the different issues related to the research that we are formulated would provide us some clear replies, some clear answers indeed. Thank you. You certainly have the opportunity to talk more about this. I don't want to interrupt you. Probably you'll have the opportunity to have the floor again later on. Thank you very much indeed. Now, let's listen to the governmental perspective with Mrs. Tufke, representing the Ministry of Family, Ministry of Department of Equity of Gender within the Ministry of Family in Senegal. Mr. Yu, could you tell us how your ministry has been working in order to integrate the analysis and gender dimensions within the family health and social protection, and what type of approach are you making use of to favor an efficient collaboration between governmental institutions, sectorial ones, health, social protection, education, justice, and others, in order to guarantee a much more coordinated answer of these needs? Thank you. You have the floor, madam. Thank you very much, Mrs. Chair. Please allow me, first of all, to thank the SAV for providing us the opportunity to be part of this panel. I would like also to thank our co-panelists as well, and I would like to greet all the different people who are with us through this platform. So in reality, your question, indeed, and I'm going to provide an answer, right, because integration of the gender issue, health, social protection at the level of our ministry can be regarded from two perspectives. First of all, we have conducted a study, notably in the health sector, in order to know exactly whatever is taking place, to establish a reference list, and then to question the legislative regulatory norms, as well as the documents of policies, meaning the secretarial, the DTBT, how the program, annual program are aligned with the budget, as well as the strategy, national plan, as well as the different administrative practices in this field of gender. And then we have elaborated as far as the health sector. a plan of gender nationalization in order to identify them in both cases that I have just mentioned. It is within this perspective we have worked mainly on the as Armenia. It is the health plan, reproductive, maternal, infantile, as well as teenagers and nutrition. So the very last plan of 2024 up to 2028, and we have also elaborated this year the second national plan in this health sector. These documents had enabled us to strengthen the device, which is adapted in order to be in line with the different type of needs for the teenagers as well as adults, including people who are in handicap position. Now, with regard to the youth who are nowadays or are making up also the main element of this reflection in this webinar, we are focusing on two different pillars. So we have also different young girls and young boys, and through these spaces, these we are making type of the promotion of the productive health. I would like to remind you that the sector of youth is guaranteeing the charge and are taking care of this. Thanks to our partners, we have elaborated the strategy. I'm speaking under the control of the NFT, which is accompanied and supported the government of Senegal in order to be in line with the needs of young youths, teenagers, but also to tackle the issue related to gender-based violence, as well as child marriage, genital mutilations, and to make sure that parents as well as youth would be within this type of forum, within this space, in order to be able to express themselves, but also to bring in the protection of the defense of this youth among all these type of elements that are just enumerated and could impact the mental health, but also to compromise the social development in this sector. How have we elaborated and integrated these dimensions within the framework of our own plans? As far as the nationalization plan of the youth, in a very cross-cutting manner, guided by the respect of human rights in all type of interventions. If you go through the plans, it's product number 5.2.4, which stipulates this. It is in this article where we talk within, beyond the cross-cutting, it does intervene in how to promote equity of gender in the action line 4.7, targeting the integration of gender dimensions. Indeed, whereby there are two dimensions. Legal framework needs to be enhanced as well as advocacy for application of laws protecting young children, women against violence. Very much as law 419 as well as 2020 Act, which punishes the acts of pedophile as well as rape. Now, in the social protection and the operation level, some health structures, we have some digital tools, very much like Ado. So these tools are helping us to tackle these type of issues. We also try to gather youth justice, family, as well as the police, the youth. All of them are do exist through our technical committee as well as other committee which is working on the national strategy which are intervening in this field. Thank you very much indeed for your kind attention. Thank you. Some multi-sectorial approach in order to tackle, so we understood that we need to collaborate together in order to go even further. Indeed, thank you very much. We, before going to the next questions, we are going to share in the chat box two links, some scientific articles which have been published very recently that you can go through right after of the webinars. The very first edition presenting the local research on the transformative gender approach in sub-Saharan Africa, which has been conducted within the framework of the program Duty for Africa. The second article called GEDA, which is highlighting some studies on reproductive health of teenagers within the fragile context. This publication provides some adequate type of data to orient politicians. Now, this would reflect the area in order to valorize research which are being conducted in the southern and to fill in the gaps within the world debate related to reproductive health and sexual rights. So do not, please make good use of these links. Now let's go back to our roundtable, and we are going to start by Dr. Nohom. Dr. Nohom, in a very concise manner, please, within 5 minutes, if I may, starting from or relying on a concrete example, what type of recommendation would you do to enhance the different data as far as a program related to reproductive health for youth, and how to make sure that the voice of the youth would be better represented within the framework of the decision makings? So could you please elaborate a little bit more? You have 5 minutes, please. Thank you very much, Nafisa Atu. I will try indeed to be even quicker. So to reply to this question with respect to in line with our unexpected, let me remind you that we have been working for 3 years within the framework of the prevention of child marriage in the region of Sandra within the framework of a project which was financed by the CRP Canada. And generally speaking, what we have learned is that the issue of health and sexual health and reproductive health issues of teenagers, generally speaking, can be listed within the social norms. Whenever we say social norms, would say all this would be anchored within the social structures, and the changes seem to be rather slow. So what I would foresee with respect to what we have already learned so far would be to privilege some program which would be structured for for a long period, a long-term basis, so that they will be sustainable, so that we'll be able to uh, change the habits of the community, and to see how we could initiate the different changes through different studies of the people indeed. And I would like also to talk about all this because there are certain things to do so, but in the same way what you had stated earlier on, multi-sectoriality would be also well considered, meaning that we need to get out from this type of specificities in order to get interested only by only one dimension. Why? Because UNFP had talked about all this. You need to focus on the education, nutrition in a very possible manner indeed, so that the outcomes as well. This would be a type of engagement at the local community, meaning why are they interested only by this and not by the other ends when are within the framework of this type of joint program. I think that it would be very difficult within the framework of type of inclusive research that needs to be done for the community indeed. Now, as far as inclusion of the youth, I think that there are plenty of things to be conducted. Why? Because generally speaking, there are always leadership programs which are financed, some youth which are taking part in certain training to enhance the different clubs to make their voices heard. But nevertheless, so the big mass which is in the rural area or in rural venues does not seem to be really involved. We need to look for certain means in order to come up with some programs and contextualize some leadership for the youth, meaning that to get an inclusion type of vision that could be valorized within the community, and probably try to create on the balance and try to find a balance indeed with a vision of globalizations and some other system, but to see how we could come up with some programs in order to include the rural population, to see how to make this community get involved. I would like to highlight again and our very last project with the CRGC Canada within the framework of a project targeting the promotion of Zama within the framework of maternal health. It's very interesting to see indeed that we could go and consult the population to define the program or the problems with them, including with youth, and to try to know what are the main obstacles to come up or to propose to suggest some local solutions, and to let the community do the sensitization and the advocacy in order to change the situation. And it goes beyond the involvement of them. We are talking about accountability of the community. I think that this approach seems to be very attractive indeed, and there happen to be some means that could be adaptable to make sure how to guarantee the inclusion and to guarantee the sustainability of whatever is being done currently at the level of our community. Thank you.
Revenons à vous. Pour la question le côté politique et
Thank you so much, Madame Diouf. We will go back to you. How do you think that research can contribute to the development of policies and practices to combat gender-based violence and promote appropriate reproductive health services? And do you have any examples of research findings that you have incorporated into your work to strengthen actions to combat gender-based violence? Thank you so much for this relevant question. In reality, the government has agreed that the research is fundamental to educate the public. And we always have studies when it comes to the health sector, and we try to protect young people and women to fight against this burden. We are convinced that when it comes to um, gender-based violence, we need access to the new policies on the data issued from these research. If I take the example of the general research that has found 1 million vulnerable people. We were based on these studies in order to formulate the project of women empowerment, and we have a project that has been inspired by the research uh, on the international research of sexual based violence. These studies allowed us to create three different projects based on the studies in 2023 and 2024. The first project that I have just um mentioned has a 4-year action plan until from 2024 to 2028 and aims to protect 1,320,000 young people between 10 and 10 and 19 years old to protect them from vulnerabilities. It has different components. The first one addresses the sexual based violence, the economical empowerment, protecting the life that addresses questions lead relevant of their sexual health for adolescent. And the second component is the access to the services in order to let them know that we are ready to improve the condition of women and young children and their well-being. Another major project has been elaborated for 7 years, 2025-2031, is to eliminate violence against women and girls that will touch the children between 10 and 19 years old, and also the women subject to violence. And we have alarming results when it comes to violence. After the study, we were also able to discover 95% of women have been subject to a physical, sexual, or mental violence for the last 12 months. And the study has been conducted in 2023 by the National Agency for Statistic Development. These numbers have been disaggregated gated by region. I will not mention it here, but I can share the communication. But what we discovered is that 21.7% of young and before 18 years old have been subject to sexual and psychological violence. This is to tell you that these are alarming numbers, and these proportions are respectively related to the age of 4.1%, set 0.1% and 3.7%, and I will share the data with you. These studies have led to the elaboration of two major projects, and the third one that we have um, and where we started implementing is to reinforce the resilience, the reinforcement and participation of women, which is a genetical study for this region that has exploitation sites for miners and other natural resources and constitute new problems to accentuate sexual violence that allowed us to adapt the project to the needs of the targets. And here, young children, young girls and women, and we needed to understand that we need the contribution of all the actors, the development agencies, the state service, the territorial administration, and this project has a duration of 3 years. So reinforcing the resilience 2024-2026. So economical empowerment 5 years, and it is in 11 regions. It's a World Bank project 2024-2028, and um, eliminating violence in 7 years in this region. It allows us to have a regional and national coverage to fight against violence, but also to find adaptation solutions for these regions in question. So, in summary, this is what we have done based on the studies that gave us proof to adapt our policies to make them efficient and to answer the needs of the targets. So, in conclusion, we can say that we will continue our efforts to promote the multi-sectorial approach, but also our inclusion efforts in while prioritizing young women and children in the elaboration and the implementation of the projects and programs in order to respond to the needs. Thank you so much. So in practice, this is how we use the data in order to create data and policies based on proofs. Thank you for showing the example. Mr. Berta, we lost you for a few seconds, but you are on time to answer your question. So everything's going well, and your questions are based. I don't know if I am freezing. My screen's freezing, or you can hear me. Yes, I can hear you. Because I am under the impression that my laptop is playing some tricks on me. It's from my side. I think my laptop has decided to stop working. But back to work. So, Mr. Nikwale, can you tell us of the practices and or innovations that you have implemented within your foundation, which could be quickly adapted elsewhere in order to improve the care of young survivors of gender-based violence? 5 minutes, please. I know you have a lot to say. Thank you so much for giving me the mic. I would like to mention that when we want to replicate the approaches and the models, we need to adapt them to the local context and to the reality to every local context. And I'd like to also mention that the model of Maison d'Orchestre, which is a transition house, but it's also training. It's a model that could be replicated elsewhere. Because what I forgot to mention is that in this Maison d'Orchestre, we have an RDG, which means with this RDG, the children of these adolescent women are kept there, are well kept there, and when their moms go to school or go to training programs. So it's a model that could easily be replicated elsewhere in an efficient way, and it would definitely help the young adolescents. You mentioned also that the model of holistic care for birth for minors. It's an innovation model, and other actors can take into consideration the fact that it can be replicated because they need to take into consideration the specificities um, of these and the preferences of these adolescents who got pregnant because they have been raped. They have special needs, and it's a model that is holistic by character, where there is a group of psychologists and social assistants that we call maman chérie or dear mom, but also nurses that are trained to care for these survivors. So these are the two approaches, the two innovations that can easily be replicated elsewhere, while taking into consideration the community work and the work with the parents. Thank you so much. So we have different approaches. So the research to be at the disposal of the decision making of the decision makers, and the decision makers who could take the right decisions. How to use the practical question, how to innovate. Madame Ebersek, I will go back to you one more time. Madame Sek will be answering in English, so please be ready for the translation. And we will talk about the international level and governmental level. So, Madam Sek, what concrete recommendation would you make to donors and to government in order to improve intersectoral coordination around the health of adolescents that we have spoken about this morning? And how does UNFPA collaborate with local actors to combat gender-based violence among young people?
En 5 minutes. Racontez toute votre vie en 5 minutes. Ça va être difficile.
Minutes, please. It will be difficult, but I trust you.
Thank you. So my main recommendation would be for adolescents' sexual and reproductive health to be considered in its own domain and not lumped together with maternal health or only viewed from the angle of family planning. So that's my main recommendation. Adolescents have their own sets of needs and priorities that must be considered and therefore invested in. So I think if that's done, then we can better coordinate as donors, as member states, as service providers, and as partners. UNFPA's third transformative goal is to end gender-based violence and harmful practices by 2030. And we're working towards that goal, particularly in Senegal, by collaborating with our partner ministries to revise legal texts so that they are in accordance with international conventions and streamline procedures for addressing gender-based violence. One specific battle that persists in Senegal is the law that allows girls to marry at 16 and boys at 18. We are also battling GBV, gender-based violence, by investing in youth centers and activities that sensitize adolescents to the dangers of harmful practices such as female genital mutilation. We are also equipping facilities to care for gender-based violence and female genital mutilation survivors, vulnerable girls, and women living with fistula. And finally, we're investing in a gender transformative approach by promoting female agency and girls' empowerment. And I think it was Madame la Directrice Diouf who talked about the New Deal, which is an approach UNFPA has invested in over the years, as well as investing in girls' clubs. We're also investing in positive masculinity and involving women, men, and boys in the discussion about gender-based violence. and harmful practices. And finally, what we're doing is mobilizing families, religious leaders, traditional leaders to talk about gender-based violence, where it comes from. It is not something that is condoned by religion, traditions, and how we break those things down. So that's where UNFPA is really placing its emphasis in terms of fighting against gender-based violence. Thank you.
Merci beaucoup. Donc,
So much. Thank you for being concise in your response, and it will allow us to go for a third round of question. But it has to be very short. So I will go for a quick round. In one word, what key message can you share with your audience today? And what would you like for your audience to um, retain from this? Or what's the key message that you want to share with your audience? Thank you so much. My message will be to interconnect the decision makers, the actors on the community level, religious leaders, young people, parents, when it comes to establishing social and policies to fight against the violence and all the phenomenon that can negatively affect these young people. Thank you so much. Doctor, in 30 seconds, what message would you like to leave your audience with today? It's very interesting. I would like us to think about the need to clarify the laws that we are establishing to improve the practices of these rights, and in order to work in order to make sure that the service provider know what they are doing, and parents know what we are talking about when we talk about these centers destined to help the young people, because some words are lost in translation.
merci beaucoup. Alors, maintenant, passons à Dr. Nkwale. Quel message voulez-vous laisser avec les participants?
What type of message would you like to leave with the participants, please? Thank you, Madam, for the floor. The message that I would like to give within the conflict areas or outside the conflict areas, there are some survivals of gender sexual violence. They are teenagers as well, men and women, girls and boys. They happen to have some specific needs, and their proportions is indeed is growing. So it's a very important number. We cannot neglect the number within this type of care given program, and there are some innovative program which is implemented that can be shared indeed within the framework of exchange of experiences that can be replicated in other places, but it is a component that seems to be substantial, which happen to have some challenges, specific and challenges that need to be taken into account, and implement some innovative approaches and very specific for this type of category. Thank you very much indeed. Thank you. So, in line with what been stated by Mrs. Abasek earlier on, is that teenagers would need to be taken as a specific group and not to be agglomerated with other type of specificities. Indeed, this would certainly lead me to ask to Mrs. Abasek, what type of message would you like to convey to the participants today?
Trust young people. When they have sufficient information and the needed support, they will make the appropriate choices. Thank you.
Parfait. Là, c'était clair et net. Faire confiance aux adolescents.
You need to trust the teenagers, indeed. I think that we have enough time to ask Lord Santier after your presentation, as well as after your type of experience, and after having listened to the panelists, what type of message would you like to share with the participants indeed? Thank you. I believe that I'm very happy I've been very happy listening to the different panelists' perspective. They have provided us with some type of a path that would that summarize what I wanted to share. First of all, we need to coordinate all together. All efforts need to be collated. Mrs. Assis had well stipulated, so this work with the youth cannot be conducted if the multi-sectorial approach is not developed. We need to sit all together in order to understand. And I very much appreciated something had been stated, which seems to be very strong, is the comprehension of what is being done, meaning that whatever we have implemented, there has been some studies which seems to be substantial. Is very important to engage within the framework of the program implementation. There again, this in line with the different studies of implementation that would enable us within the framework of the programs to understand the acceptation of what had been carried out, to understand also the adaptation of what we have suggested, and to see what are the challenges and to be able to solve this issue. I think that this is very important indeed, and that also is in line with this message. The third point that I would like to highlight, and that is innovation experiences that emerge from Congo. What the team of Congo had stated is very real. Nowadays, we need to innovate, and innovate doesn't mean that whatever has been successful in Congo would need to be duplicated and implemented in Senegal, meaning that we need to identify, analyze it. And this is why nowadays in the field of research, evaluation and analysis are being carried out that would enable us to understand within this type of framework why such intervention seems to be successful. So what type of mechanism created so that this type of intervention would be successful. So together with the decision makers, stakeholders, the role being played by the researchers is capital in order to help with this type of intervention would say to duplicate whatever has succeeded in other places, but analyzing it further. So as has been stated by Mrs. Sek Aber, teenagers could not we cannot work for teenagers without their support. Whatever is doing for me without my support is not targeted to me. So we need to help them. We need to listen to them. We need to get them much more engaged, give them the floor, and to accompany them at the same time. And I believe that this is what the projects of CRC are doing for the moment. I'm very pleased with whatever is taking place in the region, given the experience of Senegal, what we have listened so far in Niger and RDC. There are several examples in the country. Probably need to share to bring the different actors to share their own experiences. And this is what the IDRC is doing via the follow-up. Thank you very much indeed. So I hope that we will have other opportunities in the future that we will continue this type of sharing of experiences and this type of debate as well. Thank you. Over to you. Thank you, Nafi. Vous avez la parole. You have the floor, Nafi. Well, I could not put it on. We did hear you, indeed. So my computer does not function so far. No, we can hear you. No, I just wanted to mute my. I would like to add something else. So we need to keep in mind that we were teenagers ourselves. So once we leave teenagers, we seem to forget whatever had been lived by teenagers. So we need to try to be in their own position and what we used to say to our own parents. So we need to understand them. So whatever is being done without our own support would be against us. So these discussions had been very interesting. We'll carry on talking for a long time. Thank you again for this rich sharing of experience. But I will need indeed to put an end to this panel. Indeed, however, for the participants, very much as we have done it, we don't have enough time to give you the floor to ask a question, but I did say from the very beginning that you can write your questions on the chat box. So the panelists have kindly accepted to provide you a written reply, of course, and we will certainly share all this with you. So let me give the floor to Marie Glorieuse once more. Inga, Barres, and Montassar for the closing remarks. Thank you once more. Thank you to the panelists as well. You have been really excellent so far. Marie Glorieux, please, you have the floor. Thank you very much indeed. Thank you to all of you. I would like to thank all members of the panels as well as our note speaker for this rich exchange of experiences. Indeed, we could have gone for another hour. It was really very enjoyable, and this does highlight indeed this type of importance to exchange, to